Look, it's where we're going. Kumasi, the Ashanti regional capital. You know, the first exercise was organized right here in Accra. The Ministry of Local Government and Rural Development. And that's where we will take you. And they have marshaled all the resources. The Rastos give us what the indications are, everybody online, and the indications are that they have started the exercise and they just give you a sneak peek of what really is happening. But before we take you to that center where the disinfection exercise is being undertaken, would want to run you through what the figures are and coming country. Look, this is what we have. So far, the world globally, as we have it, we have a total number of cases, 532,000, still growing. And the deaths out of this number is 24,000. But there's some good news. At least 1/5 of the infected numbers or cases we have recorded so far. And this has happened since January. Until about the last 24 hours, the last 36 hours, it was China that had the highest number of cases. Now, it's shifted to the United States. United States is now the epicenter of the world. In Europe, it is Italy. Let's just run that by you. Italy so far has recorded some 8,200 deaths, but it is because Italy has some 80,000 cases recorded so far. Now, if you look at what the numbers are, they're just a third in terms of the position, the United States being the first, China being the second, and Italy being the third. And if you look at the numbers apart, they're not too many. United States of America has 85,000, and they are beating China to it just by 4,000. And Italy follows closely with 80,000. And so Italy just 5,000 apart and just 1,000 apart from China. You know, the related conversation about how China has managed the situation is that over the last 4 weeks, it's not recorded a number of the cases and the related fatalities or deaths like it did in January and February. So they've been in a position where, as of this morning, the President of the United States of America has been having a discussion. Now let's go to the continent where we have it. So we have North America. We'll take you to North America quickly. And if we go to North America, we zoom into North America, you get to find that it's where we have many of the reds around. And all these cases you find with the red dots or the red spot are all cases. Now, it's in New York, the state of New York, close by Philadelphia, and then you also do have Boston, Massachusetts. You have Washington being the hub of the cases in the United States of America. But we shouldn't forget, when you go up north a little, you have Cleveland, and up again Detroit, and many of the communities, if not cities around there, have this disease. Chicago, Milwaukee, and you have the Tampa Bay area, all of them recording a number of cases. It shows how this disease seems to have overwhelmed the world. Because even though hospitals in the United States are managing this, they seem to be overwhelmed. There are concerns that some help will be needed, but the United States of America government, the federal government itself, is trying to do these interventions. And that's why the related conversation between Trump and Xi of China is ongoing. Now, let's take you to Europe. Europe, it's where we have Italy leading with some 80,000, and closely we have Spain and then Germany. Now, you go to Europe, you have a number of the dots here. So you have the dots, many of them here, and Italy is here. Rome has a number of the cases. Look, Italy has confirmed cases 80,000, deaths so far 8,000, but 1/7 of these 80,000 cases have recovered. However, 62,000 of these cases are still active, very active, overwhelming the ICU, the emergencies, the OPDs of Italy. And there are even reports that the number of priests and at the last count, a number of them, about 30, had lost their lives. You go to France, you also have a number of cases. Greece, you go to the northern part of Macedonia, you have many areas in Montenegro, you have Sarajevo, and those cities in Europe you can find now. But look, let's go to Africa and look at our situation before we zoom into Ghana. It's a peculiar situation we seem to have. Initially, the cases started coming in through Northern Africa. Algeria, Egypt recording, Morocco subsequently. Now Libya also has a case. And then it trickled down to Sub-Saharan Africa, where we have the blacks. You know, Sub-Saharan Africa. So we have Ghana, Cote d'Ivoire, and you can find what the situation is. But you can see that if you do the analysis of the whole of Africa, it is South Africa where we have the bigger of the red dots, and we'll take you there quickly. It's where we have the lockdown. As at midnight, Thursday, the lockdown was on. Cyril Ramaphosa, the president of South Africa, decided to impose the lockdown because they needed, at the time that it was imposed, to shut down. Over 700 cases had been recorded at the time. And areas around Johannesburg, the Eastern Cape, Western Cape, etc., are all making sure that they adhere to this. The military, as well as a task force of health and other immigration officers, have been on this surface, on this lockdown as far as this is concerned. The interesting part of it is that while this is ongoing, they've also recorded their first death. And you know, South Africa is a developed country, you know, in a certain relative sense when it comes to Africa. And South Africa reported its first coronavirus deaths. Now, South Africa, by this announcement from the health minister, Zwelini Nzize, announced on Friday that 2 deaths had occurred in Western Cape province. One at a private hospital and the other at a public hospital. He also did announce, though, that the number of confirmed cases had jumped to more than 1,000, but said that the details will be given in a subsequent media briefing. It's symptomatic of how the African governments are trying to manage information in this era. It's not easy. Telling you the number of cases. We currently, according to the official statistics, we have 132. And it's also a related issues about how the South Africans are also managing this. Look, we have a story there. Let's watch it, and I will come back before we give you the rundown as we zoom in to the exercise taking place in Kumasi.
I think we just need to look at the global stats to understand why this is so important. And as I say to many people, I'm very optimistic. I know people are feeling, is this doom and gloom? What's going to happen to us? I think we need to consider the challenges that we have, particularly in South Africa. And, you know, for many of us, we say we've come through apartheid. We understand curfews. We know when people were asked not to move around because of the pass system. So this is just a very important process in our lives. It is shocking. It was really quite interesting to see our President Ramaphosa in full military gear yesterday, talking to the military. And it was a very positive, very compassionate pep talk saying, you know, you go out there, but these are our people. We are in this together. So in a democracy, to see that kind of movement.
Health Minister, South Africa. That country is under lockdown, but a number of media houses, the leading media houses, for example, SABC, will go there and get a report from there, have been working to ensure that they get the stories as it were. Let's get the latest from SABC, and then we'll come back. And if you look at the inserts there, the responses from South Africans, and that's their equivalent of what we have here, the trotro, okay? And the question about how the GPRT is also having that conversation about whether we need to reduce the number of people sitting on the seats in the trotro is also a question that is also facing the residents, if not the commuters of South Africa. It's a very peculiar, if not same situation being talked about. But if you look at the lockdown, the South African situation is telling us that they have deployed military personnel on the street, and it's very simple. For those who defy you're arrested. And you have a picture like this. We'll quickly impose it on your screen, and you will find young people who had defied a curfew of a sort, even though it's called a lockdown, I mean, technically, and they're going out. So they've been arrested by the police and members of the task force that have been deployed. You can't find a number of them. And we do know in our country, the president of our republic, Nana Addo Dankwa Akufo-Addo, had been tinkering with the idea whether we should have a full lockdown, a partial lockdown. This is how it's going to look like. If it's a full lockdown, you don't go out. So if you live in Ashaiman, you sit in your home somewhere. But as generally has been done, starting from when China did it, you will go out, whether you want to go to a grocery shop, and here we're talking about markets in our case, or you want to go to the mall, etc. That's the situation we're likely to find. So you find a military personnel lined up in the streets of Johannesburg, Cape Town, Port Elizabeth, and many of those top cities and communities in South Africa. This is full lockdown. I mean, yeah, virtually full lockdown. So that's how it looks like. While you're looking at this and thinking how the city of Kumasi or Accra is going to look, right? Look, we'll definitely take you to Kumasi. Before we speak and have some comprehensive analysis from our reporters deployed there in Kumasi, let's give you a sneak peek of what the current state of the exercise is, the deployment and when they started and the current situation. The pictures will come onto your screen soon, and this is how it is. And forget about how it's been, it's a bit shaky. It's part of the technicalities, trying to get all video and audio ready for this. Look, deployment is ready. We have all the vehicles with the various machinery, the chlorine disinfectant, also in that blue container, you can see right there, and the personnel with their masks well geared or attired is for this exercise. The exercise is taking place in Kumasi. Of course, the location currently you're seeing because of this picture is just close to Minsha, etc. But the whole of Kumasi is under this exercise being undertaken. It is a national disinfection exercise. The first one, you will remember, brought to you live on JoyNews, was convened in Accra. This is the second one. We have been promised by the Ministry of Local Government that is organizing, leading this exercise, alongside Zoom Lion, providing and supporting with its subsidiaries, many vehicles, disinfectants, etc., and other organizations and bodies also helping with this to make sure that we have markets, selected markets, just a number of them over 200, all lined up to make sure that we do this disinfection. We'll play you an insert from Kumasi where the minister for the Ashanti region is saying that this could be extended to Sunday, and it will mean that residents will need to stockpile some food. Okay, right here, we're locking it down right here on JoyNews. To get all the latest update, keep interacting with us on Facebook, JoyNews on TV. We do have a Twitter handle at JoyNews on TV. And just in case you're not by your television, you can watch us live through My Joy Online TV on YouTube, which is our official channel there. And then you get the latest update from our foremost portal, myjoyonline.com. All this right up after this break.